All right. Good morning, Rotary District 7770, and welcome to Conversations with Rotary Action People for Monday, March 8th. My name is Donald Hovis. I'm your CWRAP host, and I'm from the Chicora Rotary Club in Myrtle Beach, South Carolina. Today, we're going to talk about all things Rotary Ready. We have two speakers on the line. We'll get to them in just a minute, but we're excited to have Sandy Morkel from the Charleston Rotary Club and Bill Cannon from the Daniel Island Club, who happens to be the Rotary Ready chair. We'll get to your presentation in just a moment. I have questions for you already lined up. So let's do some housekeeping. Once again, if you're on here, please mute your lines unless you are speaking. Please use the chat box to post any questions you may have. And also, in the chat box right now is where we want you to introduce yourself by posting your name, your Rotary Club, and if you've received the vaccine, we want to know if you got 1 shot, 2 shots. If you've done a Rotary Ready event, we want you to put that in there as well. We're excited to have a nice crowd here today, so thank you for being here. For those of you on here, this is being streamed live on the district's Facebook page right now, so you can go there and share it on your club pages when we're done. And we're also recording this, and it will be posted to our YouTube channel for the district as well. I would like to introduce our public image chair from the 5 Points Rotary Club in Columbia for setting up today's program, Mary Gask. Mary?
Hi, y'all.
I would also like to say Happy International Women's Day to all the women on the line, all the women in leadership for our district, all the women in Rotary. Happy International Women's Day. I don't know if your communities are doing something special today, but here in Myrtle Beach, they're having a big International Women's Day luncheon that comes up at noon. So happy International Women's Day, everyone. Okay, at this time, I'll ask Bill Cannon to come off of mute. Bill, are you off of mute, sir?
I'm off of mute.
Thank you for being here, sir.
Good morning, everybody.
First of all, you were tapped as the chair of District 7770 Rotary Ready. What was your motivation to say yes?
Insanity. Rotary and being a Rotarian means the same thing, I think, to most of us. It's all about service above self and the 4-way test. And I was laying around in late December, not really laying around, but walking around, sitting around, thinking, if I don't try to, the whole atmosphere with respect to what was going on with COVID at that time was demoralizing, to say the least. And I just felt like I had to get involved to do something. And I thought about it for a couple of days and finally said, you know what? I'm just going to have to do something about it and jump off the ledge. I knew it was going to be a lot of work and a lot of time, but the alternative wasn't acceptable. So I gave Pauline a call, and that's how this all started for me.
So tell everyone here on the Zoom call and watching over on Facebook, who is on the Rotary Ready committee?
Well, the most important people in that committee are on this call right now: Sandy Morkel and Maureen Cannon, and Pauline, of course. On our committee, we have Cleve Ham, who is I had to think about exactly what his credentials are. We have Bob and Mary Schrader. We have the president of the Daniel Island Club and the incoming president. Basically, what we did is to just the people that were immediately ready to go and were thinking about this at the early stages. We put the committee together with them, and it being International Women's Day, I have to give a shout out to the. I think I'm the only man on the group the women of Rotary are unbelievable, exceptional. Sandy Morkel is an exceptional human being. Maureen Cannon is unbelievable. She can do anything. And these two women, I love them, and they've really made this thing happen.
So tell us how you got to where we are in just a few short weeks. I know several events have happened. Multiple people have, thousands of people have been vaccinated. Tell us how we got to where we are today.
Well, it went from an idea, right, Pauline? Went from an idea all of a sudden to Sandy Morkel being connected out the wazoo, as they say. She knows everybody. And she connected us with MUSC and Roper and East Cooper here in the Charleston area. And we got on a call pretty early. I mean, it was just a couple of days before we had something to do. Maureen put our website together, the Rotary Ready website, and we were scheduling a vaccination event within, what do you think, girls? 7 to 10 days out. And it's and because of the quality of the people that we've been associating with, coming to volunteer, not just Rotarians but non-Rotarians, it's been a very, we're starting to get smooth, which is very exciting. We're starting to figure out how to do this and do it well, and it's because of these ladies on the call right now.
So the Rotary Ready initiative covers the entire state of South Carolina. So give me a ballpark of how many volunteers do you have from our district and then District 7750, and talk a little bit about the process to volunteer.
Well, the process, I'll start with the process, and that is to go to rotaryready.com and sign up and fill out the information. What happens at rotaryready.com is that we have the ability to, when there's an event that's going to take place in a certain area, we have the ability to lay over the people that have gone on there. We'll send them a Sign Up Genius document through email once there is something that's taking place in your area. And what we're doing is first come, first serve. Whoever gets on the Sign Up Genius that signed up in that zip code or that area, it's going to get populated. The volunteerisms, the site, the people we need are going to be filled based on first come, first serve. And Maureen Cannon's on the line right now, and she's running that whole thing, and she can add all the specifics about what happens with Rotary Ready, but that's generally it. And when there's a vaccine site that happens, if you're getting the Pfizer or Moderna vaccine, they're going to lay over the volunteers and all of the people that were vaccinated that day. And it's going to happen in the Pfizer case another 21 days down the road. The whole thing will be duplicated. Volunteers and the people are getting vaccinated. If it's Moderna, it'll happen 28 days later. If it's J&J, it won't happen again. So we're getting two complete volunteer opportunities for the same people. That's basically 16 to 18 hours worth of volunteers with those two vaccines, Moderna and Pfizer.
I will say I have posted the link to Rotary Ready in the chat box if you want to go there. Those of you on the line. Maureen Cannon, would you like to come off of mute and continue that question?
Yeah, sure. So just a slight nuance to what Bill said, and I'll use this. Last week we had East Cooper Medical Center came up very quickly as a pilot. So we were informed on Monday, and we ran a first pilot yesterday with 450 vaccinations, including, and Sandy will talk about an outreach effort we did to the community. But my philosophy and approach, and there's a lot of emotionalism around the order of vaccinations and who receives vaccinations. And, it's really a gift that people are receiving in many cases. So my approach has always been to be absolutely fair in the spirit of Rotary in approaching who's given the opportunity to vaccinate. So it is in some sense a first come, first serve, but that is in terms of the order that people have signed up on Rotary Ready. So we know there's a lot of people that have signed up in January and February and are asking, when is my turn going to come? So the approach, for example, used for East Cooper, my model going forward is we needed 25 volunteers. So I reached out on day one to the first 50 people on the list in Mount Pleasant and East Cooper. And then we didn't have enough. So then I reached out to the next 50 on Rotary Ready, get the next chunk of volunteers. And then finally, the whole list was opened up. So people can feel comfortable that if they've signed up in January and February, that they will be given the first opportunity to volunteer. And that seems, to work well. And we don't want to make this sort of like a race to who's sitting in front of their computer and going to be the fastest to click it. So we recognize that people have been waiting a long time and are waiting to have a chance to volunteer and have a vaccination.
Excellent. Thank you very much. And we appreciate what you're doing for the district. I will throw this out there and Bill and Sandy and Maureen, I'm not trying to step on your toes, but I do know this from just hearing calls and being on calls that if you go to Rotary Ready and sign up, that doesn't mean you're volunteering. Do you actually get another form of communication in order to volunteer? So I think that should definitely be noted more as people just think, oh, I already signed up, I'm going to be so please note that, folks on the line, if you sign up, you do receive additional communication on dates, times, and locations. So,
Absolutely right.
Bill, back to you for a question. I think this is really interesting. So my understanding is some of the volunteers, because you can be a non-Rotarian to volunteer, are actually becoming members of Rotary. Why do you think this is happening?
Well, because we have an opportunity to get elbow to elbow, in the trenches with folks, and I think that they're seeing the value proposition that comes from within what we're doing at Rotary. I think we're the emotionalism of being able to help here is real in Rotary in general. And the people that don't know about Rotary are getting a taste of who we are and what our organization is all about. It's attracting people to the club or to clubs, to the organization. We've had, would we say 3 or 4 that have come in. We've gotten 9 members in our club in the last 6 weeks, but that doesn't mean that all of them came because of Rotary Ready. But I think it did in the abstract have an interesting. It has caused people that are just sitting in the meetings to become more intent on looking into Rotary as something that they can do, and where they can find volunteerism, they can meet people. We have the CEO of East Cooper, Lou Mello. You might want to get with Patrick. I think he's going to want to probably join your club. We have one of the heads, Maureen, maybe you can help me with this, or Sandy, the other guy that's going to join Daniel Island, who's from, where's he, Roper? I think it's Roper. Anyway, we're getting some really interesting activity on the membership side, and it's because of the attractiveness of what we're doing.
Excellent. We appreciate what you're doing for the district and Rotary Ready. At this time, the next part of the program will be directed towards Sandy Morkel. So Sandy, if you could come off of mute. We know you are the liaison for partnering the organizations for Rotary Ready. So can you tell us and the viewers on the line which organizations are on board and the areas they cover?
Yes, so we have partnerships with MUSC, with East Cooper, with Roper to a limited extent, with DHEC itself. And then the municipalities of the city of Charleston and the town of Mount Pleasant here in the Low Country, they are supporting these events in numerous ways. For example, for the East Cooper site just on Saturday, and the joint event that was held, our first pilot event, which was held on January 22nd, and again 3 weeks later. Those events are not even possible without the amazing resources that the cities and the towns bring to it. So all the tents for every single pod, all the traffic enforcements, keeping people off the roadways, the cones set up for the actual lines for the drive-through events, the EMTs to monitor the 15-minute observation area after the shots. Those are all city employees, and they are as much of a partner as the hospitals who are providing the vaccines and the nursing staff to administer the vaccines and the pharmacists to reconstitute the vaccines. They're as much of a partner as they are, and we are. We provide the non-medical roles for these events. So it's been a great partnership. I just got off the phone with, and by the way, we provided a total of, we've had 18 events so far. So there's been pilot sites in different areas: Myrtle Beach, Florence, Charleston, Mount Pleasant. We've had 18 events so far. We've done the first and second doses. We've had 20,000 doses in arms, 380 volunteers so far, and 3,000 volunteer hours. And if you put that into value terms, even at $15 an hour, that's a total of $45,000 that we've contributed with our time and energy and resource to this effort. And that doesn't count the countless hours we've all put into helping to structure this and get this into place where we're ready to roll. But I just got off a phone call with Amy Jackson from MUSC, and they are ready to go with a daily event, 2 daily events in the Low Country. One is going to be at the old DMV on Lockwood on the peninsula in Charleston. It's going to be held Monday through Saturday. They're going to ultimately be able to do, it's going to be 8 a.m. to 5 p.m. They're ultimately going to be able to do about 1,000 vaccines a day there, 6 days a week for the next 6 to 9 months. And then the North Charleston, there's going to be a daily event at the old Verizon building on Mall Boulevard. That site has a capacity to do 3,000 vaccines a day for 6 days a week for 6 to 9 months. So this is going to be a huge effort. MUSC is focusing, they have been doing these vaccination clinics at their 5 different ambulatory sites in the Low Country. They're going to go back to regular programming at those sites and funnel all their vaccines through these particular 2 sites. So our volunteer request is now going to be really ramped up. So starting February 15th, we're going to need 4 volunteers for 3 different positions, 3 shifts a day. So that's 12 volunteers, 3-hour shifts at the Charleston site. And we're going to need 12 volunteers, 3 shifts. So that's 36 volunteers a day at the North Charleston site. So we're going to need as many people in the queue as possible to help fulfill these obligations going forward. And it's exciting. We're going to be able to get lots of people into getting their vaccines. And this is in addition to the other hospital systems that are doing things throughout the state. I know McLeod is doing quite a bit in different areas. I also want to mention that the MUSC actually has responsibilities for all 46 states. They've been the preferred provider for DHEC. They probably get either the most doses or the second most doses in the state. So they are doing an outreach effort to reach out to the rural communities. And we are going to be assisting them with that effort. They're going to be going into the communities. These are communities that are traditionally African American, low income, don't have access necessarily to computers or transportation. So we are going to be assisting them with that effort. It's going to dovetail with another partnership that we have that involves Rotarians called the COVID Vaccine Hesitancy Task Force. And these are people who've come together under a nonprofit called Closing the Gap in Healthcare, whose mission it is to help underserved African Americans with their health outcomes. They are stepping up in a big way, and we're creating a campaign called I Got It. I got the shot, I got it. And we did our pilot site with the East Cooper this past Saturday, where we had a grassroots initiative, Black and Brown Faces, who were able to identify the community leaders in 5 of the African American settlement communities in East Cooper, in the Mount Pleasant area. And they manually signed up people that were elderly, did not have access to computer or transportation, and arranged those people to be registered and then bring them to the site. It was a beautiful thing. They allocated 50 vaccines for that, and we vaccinated 50 people through that process. We're going to hope to repeat that every week at that site, and then we hope that we can duplicate that throughout the state. But the rural outreach really will be through MUSC, and we're going to dovetail off of that and hopefully be trained in helping to learn the system that will register folks a week in advance of the actual vaccines. I'm going to be meeting with another person from MUSC about that approach, about the locations that they're looking at, and hopefully we'll be able to reach out. There might be opportunities for volunteers in those areas to help get those folks signed up. So lots of opportunity here. We want to really get as many vaccinations as possible and as quick of a time as possible. So this is the great thing about Rotary Ready, is that we have a ready pool of volunteers when those things are scheduled, that we have volunteers that are ready to step up. And the only reason that it's been kind of a delay, people have been signed up since January and haven't been called, is because the vaccine supply, it's all dependent on vaccine supply. And because the vaccine supply has been limited, and then there was the big snowstorms that came across this country, which delayed them from getting here, that really put a kink in the system. So there were a total, just through the MUSC system alone, there was a total of up to 50,000 people who had to have their vaccines rescheduled. So they are now playing catch up to be able to get those people in for their shots. Once they're able to catch up, then we are ready to go. There's going to be lots of events that are scheduled, and it's all, again, dependent on the vaccine availability. And the way they do that, they request their vaccines on Monday, and they don't know until Friday how many of the vaccines that they requested they will be getting, and they get them the following week for that following week's distribution. So that's why it's always going to be last minute for our announcement of big events. But this daily event is certainly something that we can plan for ahead of time, and please get signed up when that comes. We're going to start with people in Rotary Ready that are in Charleston and North Charleston, and then we're going to open it up beyond that. We're going to give them the first option, and then we're going to open up beyond that as we can to fill those spots. That's a lot of volunteers that we're going to need in that short period of time. By the end, it's going to value about $500,000 in just labor alone for these non-medical volunteer spots.
And I just want to add something really quick. Is Pauline just sent out a chat, and if anyone knows anyone in Prisma, or what's the other one, Pauline? The other healthcare network?
McLeod.
McLeod's already on board. So the Lexington Hospital System, mostly in the Midlands. So Lexington Hospital System or Prisma.
Anybody there?
Connections to, yeah.
Get us connected so that we can expand this. That's one of the things that is important. It's connections. We need connections. If we have something that we can offer significantly here, and it's we just need the connections. Leave it at that.
So I have a couple questions. You can see them in the chat box, Sandy, Maureen, Bill, so I'm not asking you something you can't see, but a lot of what we've heard today is low country, low country, low country. So when are folks in the Midlands going to be Rotary ready? obviously we just heard we need contacts at Prisma and Lexington, but
Yeah.
sounds like the Midlands are the area maybe where it hasn't been tapped in yet.
Yep, and you can establish these same relationships that we have with MUSC, McLeod in the Midlands. That's what the value of our Rotary. We have a great role model in what we've done here that can be rolled out across the state.
And the question was, can someone from Columbia work in Charleston for the daily shifts? And that has been answered with the yes. So let's see. Sandy, back to you real quick. You touched on the rural communities and those needing better access and transportations to vaccines. So what is Rotary Ready doing to help with that?
So we can use volunteers to be trained in this process. We prefer that those be when we target African American communities, it's nice to see black and brown faces in that. So if we can reach out to people that are black and brown faces that are part of Rotary Ready, that would be great. But of course, we'll take any volunteers. If you're particularly interested in that, let me know. We're going to dovetail this with the grassroots effort of that vaccine hesitancy task force that I talked about. But we also have a connection. We've reached out to the library system. And if you want to connect with your local library, this is a way for Rotarians to help. The libraries have computers. When vaccines are available, oftentimes people can come to the library, but they don't know how to access and navigate that process. So if we can help people, you can arrange through your local Rotary, helping people to get signed up for the vaccines as they come available. That would be a great service to your community. You don't have to do it formally through what we're doing, but you can take advantage of the vaccine events that are there and help get people who normally wouldn't be able to access the appointments to get them navigating that system and get them the appointments. So that would be a help.
Sandy, Rob Byko here. Because you brought up the library, I did want to share with the group. I'm a trustee on the Charleston County Public Library Board, and we are actively pursuing a program in coordination with Charleston County to bring the vaccine capability to the more rural branches in our 13 library system, and we're very excited about it as a public library to be able to bring that to some of these rural outlier counties, outlier locations, and like Sandy says, touch some of the lives that don't necessarily have access to computers and have access to healthcare. The biggest thing about managing this and setting it up is the transportation, getting people to the library locations. And I know that our executive director is looking into that and looking into collaborating with other library systems throughout the state to make that same capability actionable. So
yep, and thank you so much, Rob. And Rob's our PR chair for the Rotary Club of Charleston, and thank you for your service on that library trust as a library trustee. One of the things that they've done is paired with a Fetter healthcare system, which in this area serves the underserved community, both rural and urban. So Fetter has partnered with the library system, and they've done outreach, vaccine events, first come, first serve, not even having to be registered ahead of time, in James Island, Johns Island, and one other site. So they're going to do more of that, and we can help. I've reached out to Fetter to say we can provide the non-Rotarian volunteers to help with traffic and other things, but I haven't been able to make that connection yet. So hopefully that will be coming in the future. But again, any library system that you're affiliated with, there's 215 libraries in the state of South Carolina in 46 library systems, 43, I think, library systems. So reach out to your local library to see how you can help. And if you can set up a day, arrange a day where you can help people, if you know a mass vaccine site is coming, or if you just want to set a day and help them to find a vaccine site that they can register for, that's a great thing. But libraries have been a wonderful community resource, and we need to partner with them whenever possible.
Maureen, you just came off of mute. Are you wanting to say something?
Yeah, I just wanted Sandy to mention the role of the churches in this as well, because that was a factor in getting folks from the East Cooper to the East Cooper event.
Yeah, so we identified with this pilot group 5 different African-American settlement communities that could use the help in getting to the site, and we arranged with local churches to actually provide that transportation. We found some support there. We're working on getting deeper support, because this is going to become a regular weekly thing for the first dose and then third dose. So we want to be able, whatever we do this week, we're going to be able to repeat 3 weeks later with the same folks. And then we're going to continue that on a weekly basis. So yeah, the churches have been great, but there needs to be more. A lot of African-American churches have shut down and are not even doing Zoom services since March, all year. So they're hesitant to utilize the resources they have if it's not just for their own people. So there's some hesitancy that we have to get over through that, but I'm sure that by a month from now we'll have it figured out, and they'll be 100% partners on board.
I will say to Maureen, to Bill, to Sandy, anybody on the Rotary Ready Committee, there's a lot of stuff in the chat box. I don't know if you're paying attention to some comments or things like that. So some names have been thrown out there and everything else. So I do want to ask, you've talked about churches, you've talked about libraries, but are we making connections through local school systems by chance?
So
they've been contacted. We thought that at the beginning that they would be good locations, even in the rural communities, to have some sites. But at this point in time, now we're in 1B, the teachers are all going to be getting vaccinated. And so I don't know if Sandy or Maureen or Pauline has anything else to add, but really there hasn't been anything else that has really, to my knowledge, been discussed with the school system, other than the fact that we did think about using the schools because they have refrigeration. One of the reasons. We have been using the school we did do a vaccination event in Cainhoy at the school. So that is one thing that we did do.
Yep.
Yeah, I do know I do know in Charleston and Berkeley County, for example, there's been a major organizing effort for the teachers in the school. The vaccinations are not taking place at the school, but they're giving all the teachers a professional day so that they can all now go to one of the mass vaccination events. So we expect to see those folks, either at Lockwood or up in North Charleston, the teachers, and it's afforded to all the teachers across the Charleston and Berkeley County school districts. It's possible that it's the same across the state.
Actually, and interestingly enough, in Mount Pleasant, for example, the teachers in Wando are being vaccinated this week by MUSC in their school. They're going to do them all at the same time. And then for East Coop, or for the other high school in Mount Pleasant, Lucy Beckham, those teachers are going to be vaccinated by East Cooper. And then I just heard on the news that Dorchester is coordinating one site for all the teachers in their entire district are going to come to one site. So they're working out that for their own teachers. But it has been nice to be able to use elementary schools or high schools for as an option for the site for the public. But now that schools are going to start to gear back up again, and more of them are going to be on site, those are not locations we're looking at.
And again, one of the things that we want to do is be more informational in letting people that come to Rotary Ready at least know where vaccinations are taking place, what's happening around the state. So we're going to mirror DHEC's site, get that up on our site, right, Maureen, and try to have, because I know a lot of people call and ask me and text me and say, where vaccinations taking place, where, all the information. So the more information we can have on Rotary Ready, that's going to be helpful to people that are associating with us in this effort.
And I will say that on the DHEC site are all the CVS's, the Walgreens, the Walmarts, everyone who's offering them in their stores. But you have to remember that they're limited. I mean, you can only have 5 or 6 people in at a time. So they're limited on how many appointments they have. But the mass vaccine events are really where you can get most people in. They don't necessarily have those on the DHEC site because they're usually scheduled within days of the event and they sell out within hours. So I would say in addition to the DHEC site, you should also look at the major healthcare systems, which are the majority of the vaccines that are coming into the state are coming through the healthcare systems. So look at MUSC's COVID site, look at East Cooper's COVID site, look at McLeod's, look at Prisma's, look at Lancaster's. These are where they're actually doing them through their own portals, and that's where you can get those appointments set up. I saw Steve Morse, who's on here from our club. He had to go 2.5 hours to get his site because it was the only last one that the CVS had anywhere near here. We don't have to do that. You're going to have opportunities here with these daily events and with the mass events that you don't have to drive. So I'm so sorry, Steve, that you have to drive. Just make sure that you're in Rotary Ready, and we'll get you registered for one of those daily events, and hopefully you can get your vaccine through that.
All right, folks, let me jump in here, and just out of respect for everyone's time, we're going to start wrapping it up. I have a couple questions, though, I think that need to be answered as we conclude. And actually, this one was, I signed up for Rotary Ready. However, I don't recall being asked to enter my racial identification.
Right. I don't think we've ever asked that.
And then there was a comment posted, encourage libraries to reach out to Rotary Ready if they need volunteers to assist. So is there a way that libraries can reach out to Rotary Ready? Is there an email address? Is there a phone number? We know Rotary Ready is where volunteers sign up. Can we answer that question?
I will answer that question. I will get that information over to Angela Craig, who's our executive director, and get her in contact. Who should I refer her to?
Maureen Cannon.
Yes, so,
Maureen?
and if you go on the Rotary Ready website, there's also a capability to send an email message, and I try to keep up as best as I can and answer them, pretty promptly. So we'd be delighted to have input from the libraries.
All right. Well, first of all, thank you to Bill, Sandy, Maureen, Pauline, everybody that's doing things for Rotary Ready. We greatly appreciate it. Thanks for coming on and sharing an update with us today. As I said, this is currently broadcast live on the district's Facebook page. Please share this. It's also being recorded and will be posted to YouTube a little bit later this week. And those 31 people that are on this call, thank you for being here. We do this series every Monday at 11 o'clock called CWRAP, Conversations with Rotary Action People. So your next 3 speakers, here we go, folks. Next week, past District Governor Lou Mello, Rotary Youth Exchange. Next Monday, CWRAP at 11. On March 22nd, we'll hear from Herman Dixon to talk about Shelter Box. And then on the 29th, to round out March, it's hard to believe we're going to say round out March already. We're going to hear from Karen Jackson talking about ponds and rain runoff, what you need to know. Some exciting things coming up. I will ask at the end of this call if members of Rotary Ready will stay on for a few short minutes for some questions. We would appreciate it. But at this time, I'll conclude with the Rotary 4-way test. Of the things we think, say, or do, is it the truth? Is it fair to all concerned? Will it build goodwill or better friendships? Will it be beneficial to all concerned? Have a great day, folks. See you next Monday on the next Conversation with Rotary Action People. Take care, folks. That's